Hey everybody, it's Dr. Andrew Kim. I'm a board-certified psychiatrist, and today we're going to continue our series of videos on sleep, but we're going to specifically focus on sleep medications. Now, we're going to actually do a series of videos on different categories of sleep medications, but today we're going to focus on benzodiazepines. That's right, benzodiazepines when they're being utilized as sleep medications. Now, before we jump in, I want to remind you, I am not your doctor. This is not meant to be personal medical advice. Again, this video is for informational and educational purposes only. Always, always, always consult with your physician, your nurse practitioner, your qualified medical professionals for your own personal medical advice. I'm using this to make this an educational video so that you are as educated as possible, you are as informed as possible, and you are the best advocate for yourself. That's the purpose of this. And I also want to say, much of what we're going to cover today is going to cover the potential risks and potential pitfalls when utilizing benzodiazepines. But this is not meant to be a judgmental video. This is not meant to demonize the use of benzodiazepines. Look, I am a psychiatrist. I prescribe benzodiazepines. They have a role. I utilize them. Sometimes my patients need them and benefit from them. But it's very hard to find candid educational content about some of the potential risks and potential pitfalls, and that's the point I'm making this video. All right. So first of all, what are benzodiazepines? Benzodiazepines are a category of medications that have been utilized to treat things like seizures and epilepsy, severe muscle spasms. They're used to treat situational severe anxiety, and they've been commonly used to address insomnia, which is the difficulty of falling asleep or staying asleep. And it's one of the most commonly prescribed medication types for insomnia in the United States. And that's why it's kind of important that we discuss this, okay? Now, you probably have heard some of the names of some of the most common benzodiazepines out there. And these are things like alprazolam, which is Xanax, lorazepam, which is Ativan, clonazepam, which is Klonopin, and diazepam, which is Valium. So yeah, you've probably heard these names. You probably know someone who's taken these, or you've taken them yourself. These are benzodiazepines. They all belong to the same family or category of medications, okay? So they're very similar in how they work and what they do. What sets them apart? What makes them different? The reality is, what makes them different is timing. And what do I mean by that? The difference in how quick they're absorbed, how quick they kick in, how long they last in your system, and how long it takes for it to be cleared out of your system. So the timing is what sets them apart. For example, Xanax or alprazolam kicks in pretty quickly and leaves your body pretty quickly. Diazepam or Valium is a little bit slower acting, and it can potentially even build up in your system with chronic use. So again, it's the timing that sets them apart from one another. But essentially, they're all part of the same category. All right. So how do benzodiazepines work? Okay, we'll touch on this briefly. Benzodiazepines work on a specific receptor in your brain, a very specific receptor called GABA receptors, G-A-B-A, GABA receptors. When these medications interact with GABA receptors, they basically enhance a signal in your brain. It's kind of like a slow down signal. Slow down, all right? And it's this enhancing of the slow down signal that causes you to feel sluggish, drowsy, sleepy. Okay? And that's the whole point. You're trying to cause sleepiness in hopes that, in an ideal scenario, you're helping someone fall asleep faster and stay asleep longer. Now, this works for some folks. It doesn't work for others. But for everyone who's taking these, you need to be aware and educated on the side effects, okay? Before we get to that, how should these medications, how should benzodiazepines ideally be used? My simple answer is, in an ideal world, you wouldn't be using them, okay? I would hope that you could find ways by addressing your stressors, lifestyle changes, good sleep hygiene techniques, and addressing your medical and psychiatric issues that you could improve your sleep and address your insomnia that way. But look, I understand, okay? This is not a perfect world. We don't have perfect lives, and there will come, times and situations where you may end up needing these, okay? And if that is going to be the case, I generally recommend the following guidelines, okay? Number one, these should be utilized for short-term use, okay? Number two, try to utilize the lowest effective dose that you can get away with. And number three, if the use of these benzodiazepines are going to go beyond short-term use, try your best to use them episodically, okay, and periodically here and there versus kind of a day in and day out, night in, night out, chronic type of use, all right? So to summarize again, short-term use if possible, lowest effective dose you can get away with, and trying your best to see if you can just use them as needed versus kind of continual chronic basis, all right? So what are some of the potential short-term and long-term side effects and potential risks that you have to be aware of? Well, let's start off with some of the short-term ones, okay? The obvious one, like I mentioned before, is drowsiness and sleepiness. So we're purposely trying to give you a certain degree of sleepiness. That's the whole point. We want to help you fall asleep faster, stay asleep longer. But that can go overboard sometimes and lead to unwanted daytime sleepiness or daytime sedation, okay? And no one really likes feeling groggy, tired, sleepy, and having a hangover effect in the daytime, all right? Other potential risks are going to be things like problems or impairments with your memory, concentration, and attention. It can impair your coordination. All of these things combined can lead to an increase in the risk of falls, a decrease in your reaction time, an increased risk of car accidents, okay? So these are some of the well-known, well-established potential short-term side effects. Now, if you think about it, because of all the things I named, in particular the memory and attention issues, the increased risk for falls, okay, benzodiazepine use, especially chronic use, really is not recommended for the elderly population, okay? And again, every situation is unique. There may come a time and place where it's needed for the elderly, but again, if possible, you want to limit how long you're using it, you want to limit the doses you're using, because the last thing you need is your loved one or yourself who's elderly having a fall, breaking a hip, breaking a leg, and then, that causes a whole series of other issues where you need to be hospitalized, have surgeries, have rehab, okay? So again, really try to limit the use in the elderly, okay? Now, the longer term risks that you have to kind of look out for are the potential risks for abuse, the potential risks for developing a tolerance, okay? And because if you have gotten to the point of developing a tolerance, there is a risk for actual physical and mental emotional withdrawal, okay? So the risks of tolerance, dependence, and withdrawal are real things to consider, okay? What are some of the other unique safety considerations that you have to keep in mind? Well, one of them is drug-drug interactions, okay? So if you are taking benzodiazepines or planning on taking these, you have to look at your list of other medications, over-the-counters, supplements. Are you already taking something that puts you at risk for drowsiness, sleepiness, sedation? Okay? Because if you already are on something like that, you're adding another medication that's going to do that. And you want to be careful of that combined effect, okay? Because sometimes you can get what's called a synergistic effect, meaning 1 + 1 can actually equal 3, and you get kind of greater sedation than you would have expected. They almost have this kind of combined effect and boost sedation more than you would expect, okay? So again, drug-drug interactions. Talk to your prescriber, make sure that it's not going to be a problem with whatever you're taking already. The other thing you have to consider is not just drug-drug interactions when you think of it from a prescription medication standpoint, but interactions with alcohol and interactions with your recreational or illicit drug use, okay? Because look, people use drugs, let's be real, all right? You have to be careful, all right? Alcohol and benzodiazepines basically are almost the same thing, and we'll get into that in a minute, all right? But literally, alcohol and benzos are pretty similar, chemically speaking. They act on the same receptors and similar parts of the brain, and combining the two, that's one of those synergistic effects I just mentioned. And combining too much of them, too much alcohol, too much benzodiazepines, can be deadly. It could be lethal, because not only can you get too sleepy, because it's almost like you're overdosing on the same thing, it can cause your respiratory drive, your breathing rate, to go so low that it becomes lethal. Okay, I know that's scary, but it's a real thing I need to mention. So be careful, be cautious, and honestly avoid, that's my recommendation, is avoid combining alcohol with benzodiazepines. You also want to be careful with other kind of substances like heroin or opioids, like pain medications like Vicodin, Oxycontin, fentanyl, Dilaudid, etc. Because again, you're worried about the combination causing too much sleepiness and drowsiness and sedation, and also lowering your breathing rate and your respiratory drive to, again, unfortunately put you at risk for actual death, okay? So it's a scary thing to talk about, but it's the reality. So be mindful of how it interacts with your drugs, alcohol, and even your recreational or illicit drug use, okay? But you're asking yourself, is there really a potential for abuse, tolerance, dependence, withdrawal? Is this just a scare tactic, a shock tactic, Dr. Kim? Are you just BSing me, okay? No, the answer is no. Why would I be wasting my time trying to yank your chain or BS you about these things, all right? I meant it before. I wasn't using it as dramatic effect, that benzodiazepines and alcohol are very, very similar, okay? Again, I'm going to preface this by saying I'm not trying to demonize benzodiazepine use. I prescribe benzodiazepines, okay? I prescribe them. But when I prescribe them to my patients, I am very blunt and I am very explicit about some of the potential risks that come along with benzodiazepine use, and that includes things like the potential for developing a tolerance and developing a dependence and putting you at risk for withdrawal from benzodiazepines, okay? Look, I'm going to illustrate this example for you to make this as tangible and relatable as possible, okay? Like I said, alcohol and benzos both act on GABA receptors. They both act on GABA. So think about alcohol usage, okay? And think about if you know someone in your life who has alcohol use issues, or maybe you have issues yourself, okay? You start off by drinking a few drinks, and I don't know, let's say a 6-pack gets you buzzed and drunk, okay? And you do that every day for a few weeks, and then you realize a 6-pack just doesn't do it for you anymore. Now you need a 12-pack. Later, you need a 30 case, okay? And that's what I mean. You develop a physical tolerance. You need more of the same substance to get the same effect. And eventually your body develops a dependence, okay? And what happens if someone has developed a tolerance and a physical dependence on alcohol and they stop cold turkey? They go through alcohol withdrawal. And that consists of things like shakes, sweats, fast heart rate, skyrocketing blood pressure, nausea, vomiting, diarrhea, and worst case scenario, it can make you delirious and lose touch with reality, and you can actually have seizures and go through alcohol withdrawal seizures. So many people who have moderate to severe alcohol use need to get hospitalized for their safety, to go through a medical detox in a supervised hospital setting. What do we use commonly to detox alcohol patients for alcohol withdrawal? Ding, ding, ding. We use benzodiazepines. That's right. We treat alcohol withdrawal and we use benzodiazepines for alcohol detox. We're using these to detox people off alcohol. And why is that? And why does it work? Because chemically speaking, okay, benzodiazepines and alcohol are pretty much the same thing almost. So I tell my patients, I literally tell my patients, you have to understand that I am prescribing you, in essence, kind of prescription grade capsules and tablets of almost like alcohol in a sense, okay? And, I know they're not exactly the same thing, but chemically speaking, they're pretty similar enough that I can detox someone from alcohol with benzodiazepines, okay? And this is what I mean. Just like with alcohol, chronic usage of benzodiazepines, chronic usage at high enough doses can lead to a tolerance, a physical dependence, and then a withdrawal phenomenon when you're trying to get off of them, okay? Look, some people are genetically blessed, all right? I know some patients who can take the same dose of Ativan or lorazepam day in and day out for decades, and they swear they don't need a higher dose. The same dose works for them just as well as it did 10 years ago. And I've seen it happen. And that's great in those scenarios if they can get away with that. But many people, for many others, like I would say what I just described is the exception. For most people, chronic use at moderate to high doses, even within a few months, people are going to describe noticing a tolerance forming. They'll say, Dr. Kim, this dose of Xanax, this dose of Valium, this dose of Klonopin, it just doesn't cut it anymore, okay? I think we need to up my dose. We need to double my dose. And that's really the more common scenario. And that's why earlier I kind of prefaced this whole thing by saying limiting the use, trying to use the lowest dose possible, and trying to use it here and there. It's to avoid developing this tolerance, this dependence, and then lowering the risk of going through some kind of withdrawal when you want to stop taking benzodiazepines. And on that note, if you are someone who is taking benzodiazepines, always, always, always consult with your prescriber, your qualified medical professionals, and get personal direct medical advice from them on what is the safest way for you personally in your situation to taper off these benzodiazepines, okay? You don't want to just make that decision on your own, okay? Because there are risks, just like with alcohol. Benzodiazepine withdrawal is very similar to alcohol withdrawal, not surprisingly. If you have developed a tolerance and a dependence and you're coming off of benzodiazepines, similarly, you can experience an increased heart rate, increased blood pressure, tremors and shakes. You can get disoriented, confused, and yes, unfortunately, you can also experience withdrawal seizures. You can actually have a seizure from coming off of benzodiazepines too suddenly. It doesn't mean you have epilepsy, but you have seizures because your body and your brain are having such an abrupt drop-off from the levels of benzodiazepines they're used to, okay? So again, always consult with your medical professionals on how it's the safest for you personally to get off these medications if you're on them. So if you've enjoyed this blunt and transparent video on benzodiazepines and its potential risks and benefits, please subscribe to my channel. Please like this video. I want you to be educated. I want you to be informed. I want you guys to have the facts. And please remember, we're going to do a series of this. We're going to have upcoming videos on sedating antidepressants and antipsychotics, melatonin-based drugs, non-benzodiazepine hypnotics like Ambien and Lunesta. So please subscribe, stay tuned, be happy, be healthy, be well, get some sleep, get some rest. Dr. Andrew Kim signing off.